And earlier I spoke to the Federal Minister for Mental Health and Ageing, Mark Butler. He was in our Parliament House studio. Mark Butler, thanks for being there.
Hello, Tony.
Are you aware that as many as 6,000 elderly people may be dying prematurely in nursing homes as a result of indiscriminate use of dangerous antipsychotic drugs?
Look, I'm not aware of those as hard numbers, but I am aware of the cases that your program's outlining individually. In the lead up to our announcement of the aged care reform package, I held a number of forums along with Alzheimer's Australia over the course particularly of last summer. And I heard a number of cases where families were concerned about the use of antipsychotic medication for their family members in aged care facilities, not for the treatment necessarily of psychotic symptoms, but essentially for behaviour management.
All right, we'll come to what can be done to fix that very serious problem in a moment. But as you've seen, the estimate of 6,000 was made by Professor David Lakuta, one of the country's leading experts in this field. Now, his concerns were backed up by at least two other very senior and very concerned experts. Does your department accept that large numbers of elderly people with dementia are dying prematurely in nursing homes?
Well, what we do accept, the hard evidence I've seen is that there's a very high use of antipsychotic medications in nursing homes. As I said, not necessarily for the on-label use of the treatment of psychotic symptoms, but for other behaviour management. I think that has been a concern for some time. It was a concern particularly identified as I talked to families through the course of last summer. We've had a number of programs in place for years now to try and lift the level of understanding among aged care facilities and also prescribers, namely general practitioners, about the proper use of antipsychotic medications. But clearly it seems to me very much we've got a way to go.
More than a way to go. What are you being advised by your department on the potential number of people who are dying prematurely as a result of the misuse or inappropriate use of these drugs?
I've not got any advice about the numbers of potential deaths, and as a result of some of the evidence you've produced in this program, I'll be seeking some advice on those things. But I have sought advice about ways in which we can improve the prescription behaviour, particularly relating to the use of antipsychotics, from the National Prescribing Service. And I've also sought some advice about other different programs that the Commonwealth funds, again, to improve the management of behavioural symptoms of dementia, which essentially are at the heart of your story.
Indeed, and I will come to that. But can I put this to you? If these numbers, even if they were remotely correct, and these are numbers produced by experts looking at peer-reviewed studies, even if they were remotely correct, if we were dealing with younger people dying prematurely because of the inappropriate use of dangerous drugs, there'd be a royal commission, wouldn't there?
Well, I think that's right, and I think that is a symptom of the lack of profile that dementia has historically had as a very, very serious condition, and the treatment of people living with dementia has had as a community responsibility. I think we've come a long way over the last several months, particularly through a campaign run by Alzheimer's Australia. And last Friday, the health ministers of all jurisdictions agreed to a proposition that Tanya Plibersek and I took, that dementia be added as the 9th national health priority. Now, that won't be of much solace to the families identified in your story, but I think these issues are a broader symptom of a problem we have in the health system and in the aged care system in terms of the profile given to what is now such a major health challenge for us.
Yes, well, I don't think anyone until now has recognised the fact there could be hundreds, if not thousands, of premature deaths. I mean, that, to me, personally, I'm shocked by that. You said that if it were young people, there would be a royal commission into it. Will there be, if you look at these figures and your department agrees with the experts that maybe hundreds, if not thousands, are dying prematurely in nursing homes, would you commission an inquiry?
Well, I didn't say there should be a royal commission. I was responding to your statement.
Well, you were agreeing that if this was happening to young people, there would be a royal commission.
Well, there'd be an outcry. There really is I think, a significant challenge we have as a country in terms of the seriousness with which we treat health treatment and aged care treatment of people in nursing homes, and the degree to which it is a bit out of sight and out of mind for all of those other than family members of their loved ones who are living in those nursing homes. I think that is a broader challenge, and the prevalence of dementia in nursing homes means that the locus of that challenge largely is around the treatment of dementia.
OK. Do you accept, therefore, that there are severe consequences for large numbers of dementia patients treated with high doses of antipsychotic drugs as a form of control, as a way of keeping them docile so that they don't get up and walk around and perhaps do anything inappropriate themselves?
Well, look, I'm not a clinician, but what I do accept is that I've heard so many stories, and some overseas evidence from the UK and the US as well, that there is very significant use of antipsychotic medication essentially for behaviour management rather than psychotic disorders. And there is an indication that that might be used as a last resort after non-pharmacological attempts at controlling behaviour have been tried, but some of the cases your story talks about, other cases I've been told about in forums that I've been involved in, indicate that often those are the first resort and not the last resort. And that is why a number of the elements of our aged care reform package go to try and better equip aged care facilities to deal with this. More staffing for dementia residents or residents with dementia, particularly with high levels of behavioural and psychological symptoms of their dementia. Increased funding to the Behaviour Management Advisory Service, and as I said, a greater general focus on the challenges associated with really what is going to be the major health challenge of the 21st century, a challenge that I don't think is well understood in the community.
Well, I mean, you're clearly right about that, because currently, according to the Alzheimer's Association, there are 140,000 patients with dementia in nursing homes in Australia at the moment, which is why you could potentially get these very high figures of people dying prematurely if these drugs are administered inappropriately. So let me put this to you. Should there, at the very least, be a federally mandated pharmacy audit of all nursing homes as a matter of urgency?
Well, what I've asked for is advice from the National Prescribing Service, which is the government-funded authority that's expected to oversee good prescribing practice. And I think that's the first thing that I should do. They've done some work here at trying to equip general practitioners, as I said, in aged care facilities with the best possible advice about how to prescribe medications like antipsychotics.
But if you
I
don't,
want some advice about how that has gone.
All right, can I just interrupt you for a moment there? You can only really know what's going on in nursing homes. There are very many of them right through the country. If in each nursing home you know exactly how many patients they have who are being administered these drugs and in what quantities. That's what an audit would produce. Is that a good idea?
Well, that's not something that's been raised with me by consumer organisations. I'm happy to have continuing talks with them about the best way they think we should follow to get better information about this in terms of what's happening out there, and then to start to develop strategies to improve the practice in aged care facilities. I'm happy to have that discussion with Alzheimer's Australia and other consumer representative groups. So I'm not in a position to commit to that now, but what I am committed to doing
is that something you wouldn't rule out, an audit, a pharmacy audit?
I don't rule it out, because I am committed to getting a better understanding at government level and for consumer organisations, and most importantly for families, about what exactly is happening in aged care facilities with the prescription of antipsychotic medication to people largely with behavioural symptoms of dementia rather than psychotic symptoms. I think we do need to get a much better understanding of what's happening there, and then develop strategies to improve the position. I'm convinced we need improvement. It's really getting a better level of information to understand how we get that improvement.
You may be familiar, in fact you are familiar, I'm sure, with the first case in Margot O'Neill's story since it happened in Adelaide. A 63-year-old John Burns was administered 45 milligrams of the drug haloperidol over a 5-day period. Now, the regional clinical director responsible for that area, Dr. Craig Whitehead, has told us he would have prescribed no more than 5 milligrams over the same period, 5 as opposed to 45. The doctor who prescribed the drugs to Mr. Burns told the coroner that he did it to protect staff. Do you accept that that may be a kind of widespread thing that's happening in nursing homes?
Well, look, I have heard cases about that, and I read the coroner's inquest report on that particular case. And often those things seem to me to be happening as a resident comes into an aged care facility for their first few days, and because of the new environment, because of the trauma of leaving their own home and moving into a facility, I'm advised often there are some of these agitation problems, sometimes disinhibited behaviours and so on. This is a very common story. It ended very tragically in this family's case, but it's not an uncommon story. What I also found interesting, though, in this inquest report was that the staff members involved seemed to be not relaxed, but certainly not particularly flummoxed by the behaviour of the resident concerned. It is the sort of behaviour you see very regularly in aged care facilities. So at the heart of this, I think, is how do we better equip facilities and workforce to be able to use non-pharmacological ways of dealing with these behaviours of agitation, disinhibited behaviour, which can often be sexual and such like, before you move to the last resort of a pharmacological intervention, particularly with antipsychotics.
Yeah, it seems that in many, if not most cases, these antipsychotic drugs are administered to dementia patients without the knowledge or therefore the informed consent of their carers or families. Now, should that change immediately? Should there be some sort of system put in place where the families are told exactly what kind of medications their loved ones are being put on and the potential consequences?
Well, my advice is that where there is significant cognitive impairment, as there is generally with the residents we're talking about, that there does have to be a third-party consent to those sorts of prescriptions. I've read some concerning advice about the levels of consent that is actually recorded about these prescriptions. I think there are state authorities in place to deal with this.
Really happening.
It's a very low level. There's a very low percentage of families, at least on one piece of research that's been provided to me. So I think this is also one of the pieces of work that we need to do with the sector to better understand quite what the prescribing behaviour of GPs is of these medications and particularly what the levels of consent by family members are.
Do family members have enforceable rights in this matter, or is it just an informal thing where doctors decide whether or not to give complete transparency to the patients or to the relatives of the patients?
Look, my preliminary advice, and I'm not an expert in this area, is that this is a matter at jurisdiction level, so at state and territory level that might differ. But in most jurisdictions there is requirement for a family member or designated third party to provide authority for the prescription of medications like this. But I think this is one of the other pieces of work that we need to do with some of the consumer groups involved.
Finally, do you accept the argument that the human rights of many dementia patients are being ignored?
Well, when you go to issues like consent, when you go to issues like the proper prescription of medications before non-pharmacological interventions have been tried and shown to fail, I think this is arguably seen as a human rights issue by organisations like Alzheimer's Australia.
What about by you?
And most importantly, by me as well, but most importantly by families of the residents that you've featured in your stories and many other residents who I've been talking to over the last several months.
Mark Butler, we've run out of time. We thank you very much for coming in to talk to us tonight.
Thank you, Tony.